All right. Well, thank you everybody very much for joining the three of us this morning for this workshop on how to manage, treat, and prevent back pain with some conservative measures and things that people have really, really good access to and can get into pretty quickly and efficiently, which is only going to help make that back pain get better even faster. And really excited to bring you that information. So my name is Dr. Phil Finnemore. I own WorkFitME Mobile PT here in the Southern Maine area, where I help busy Maine professionals to maximize their physical performance so they can live a happy, healthy, and wealthy life doing what they love with who they love. Also joined by Dr. Casey Winters and Tricia McIntyre. So Dr. Casey, you want to introduce yourself real quick and let everyone know who you are and what you do?
Yeah, sure. So Dr. Casey Lynn Winters from Unbound Potential Chiropractic. You'll be hearing a little bit more about this, but we use state-of-the-art technology to get to the root cause of your nervous system concerns. And so what that means is we use a technique that doesn't do any twisting, cracking, or popping, and that can work really well for folks who are struggling with some aches, pains, and discomfort and dis-ease throughout the body. So thank you, Dr. Phil, for having me here today.
Of course. Yeah. Thanks for joining forces on this. And Tricia, tell us a little bit about yourself and Perfect Fit as well.
Yes, good morning. I am Tricia McIntyre. I'm a certified personal trainer, certified group fitness instructor, and certified nutrition coach. I just love everything about health and fitness. And so I opened up Perfect Fit Health and Fitness, which is off of Route 1 in Scarborough. We offer personal approach to fitness. So what that means is personal training, small group classes, and nutrition coaching. I know everyone who walks through that door. We get to know each other, their goals, and I'm here to get you those results that you want.
Awesome. That is fantastic. So without further ado, let's jump into this. Dr. Casey is going to kick us off, and we'll roll through a nice little progression here through the workshop. So take it away.
Sounds good. No, that's not what we wanted. Here we go.
All right.
So, okay, Unbound Potential Chiropractic. So we're located in Scarborough, right off of Route 1. If you're familiar with Louise Natural, we are just across the street from them. So we're here locally, and we love to take care of individuals and families. Now, we talk about this in the practice a lot, and I'm sure it'll be a reoccurring theme that you'll hear the rest of the folks talk about this, or I guess it's this morning. But chiropractic isn't instantly designed to make you feel better. What we're really concerned about is how your body is functioning and how we can maintain function moving forward. So, in our practice, this is what I look for. So we know that the brain sits right on top of our body there, and we have the spinal cord that comes all the way down and attaches from your brain all the way to your tailbone. And this spinal column, not only do these nerves travel up and down the body, but they also branch out and go to all the different organs, tissues, cells, and functions of your body. And this is very important because these nerves are sending very specific messages for very specific functions. So right now your heart is beating, your lungs are breathing, and you guys don't have to think about that because your brain is communicating with the rest of your body. Now, over time, the bones in the spinal column can get moved out of alignment. So they're all stacked like this on top of each other. And these bones can get moved out of alignment, and they can put pressure in the nerve in that area. And that's what we call a subluxation. So I like to review a little bit of anatomy before we move into how chiropractors can help with this low back pain concern, right? So these bones can get moved out of alignment, like I said, and it can put pressure on the nervous system. So you can see in that bottom picture there, that nerve is being pressed upon, or it has been impinged, depending on how you want to word it or say it. And at that point, the message getting from your brain to your body isn't adapting. It's not getting there at 100%. So similar to when you are, so you turn on a hose, right, in your backyard. And what happens is the message comes rushing out, or in this case, the water comes rushing out. But if you have a kink where there's being pressure placed on it, the messages that are supposed to be getting all the way down, or the water that's supposed to getting all the way down, can get decreased or diminished, and it's not working at its full potential. So, wrong way. What we do is we look to see where there's pressure on those nerves and how we can remove that so that your body can function to its maximum capacity. Let me go back to this slide here. So in the upper spine, if we have one of those subluxations, those nerves go to your eyes, your ears, your nose, and your throat. So a subluxation there could look like anything from headaches, migraines, dizziness, insomnia. Hormonal concerns can stem from that area as well. Then you come into the mid-back, and those nerves go to your heart, your lungs, and your stomach. And so if you have a subluxation in that area, it could look like high blood pressure, low blood pressure, asthma, allergies. In the stomach, it could look like indigestion, reflux problems. And then you move down into the the low back, and those nerves go to your small intestine, your large intestine, your bowels, your bladders, and subluxation in that area can look like IBS, Crohn's, constipation, urinary frequency or infrequency. It could look like concerns with reproduction. And in females, one thing that can have some dramatic changes is heavy bleeding and heavy cramping. So not only is it strictly important to get your spinal cord checked for low back pain, because those nerves also go to your legs and your arms. And this is really where Dr. Phil and Trisha, that's their huge specialty. But for me and for chiropractic, it really looks like getting the pressure off of those nerves and making sure that your brain is able to communicate with your body. And we know that as you start to function better, you'll start to feel better, because only 20% of the nerves in your body send messages for pain, while 80% of the nerves in your body send messages for function. So like I said, we know that if your body is functioning better, you'll start to feel better over time. And if we only address the pain points, which I'm sure Dr. Phil has so much knowledge about this as well, if we only address the areas of pain, we're missing out on a huge portion of the rest of your body. And this is the technique in our practice that we use. So I know a lot of times, well, people have either never been to a chiropractor and they're interested because maybe they have some functional disabilities that they are concerned with, or maybe they've been to a chiropractor and it wasn't the best experience. They didn't love it. Maybe it didn't work for them. And so they have kind of put chiropractic on the shelf and maybe would be interested in coming back one day. Well, this is your one day. This is a great opportunity for you to see a different sort of chiropractic. So like I said, we don't do any twisting, cracking, or popping. We use this instrument that releases at 6 pounds of pressure. And I know that can be kind of hard to imagine, but imagine taking your hand and pressing on it just like this. The amount of pressure that it takes to change the color of your palm is the amount of pressure that we use to make adjustments. So it's very light and gentle, and it's really great because we're able to help teach the body how to change these patterns that you've learned that might not be efficient. And instead of telling the body, this is where it needs to be, and this is where I believe that your system should work at maximum. nobody likes to get told what to do. And so we really take your body into consideration and allow us to teach it, and for it to teach me in return where the subluxation is occurring and how we can best work with it moving forward. So I think that is a great place for me to wrap up for this morning. But I want to leave you guys with the thought that your body's ability to heal is far greater than anyone has ever led you to believe. And now throughout this, I didn't necessarily strictly talk about low back pain, but you can see how as your body starts to function better and you take care of some of the underlying concerns, you would start to get relief and be alleviated from this low back pain. I think that's all I have for you today. Any thoughts or questions for me right off the bat, ladies?
That was fantastic.
Thank you.
Yeah, that was awesome. Yeah, if you could throw the host back to me, Casey,
Oh,
I
yeah,
will.
of course.
And while you do that, I will just add a couple things because I really like what you said about function, right? That's kind of the helping to retrain some of that function from a physical standpoint is really where a lot of my expertise lies. But another great a great thing to kind of keep in mind and to bring up in relation to the 20% of the nerves in our body dealing with pain and 80% dealing with function, as you talked about, our brain and our nervous system adapt to that pain really quickly.
Mhm.
And because the brain wants more information about that pain, it starts to recruit a little bit more of those other nerves that tend to do other things in that area, or it can, right? Especially when pain gets chronic. So that's where some of those other nerves that do things like function get pulled into the pain cycle, and that's how we can get into a chronic pain cycle. That could be a whole nother workshop that we could do, but I just wanted to bring that up because it is, the function part is so important, because not only do we have to address the pain, but we do have to address and kind of retrain the function, because
Exactly.
a lot of times when pain is present, and it has been present, it doesn't have to be there for a very long time either before some of those other nerves in that general area get recruited to try to give that brain more information. Unfortunately, it's getting information that it doesn't know how to interpret, so it just interprets it more as pain, and those other nerves tend to not work as well. So yes, that's a great segue into some of what we're about to talk about. Did you have something else you wanted to add to that?
No, I just don't think I know how to send you back into host.
Oh, I think I'm there.
Oh, perfect. Awesome.
I think I'm good. Oh, maybe I'm not. If you click on my name where it says more over in participants, if you hover over it, it should say more, and you should be able to scroll down and say make host.
Okay, I got that.
Okay.
There you go.
There we go. Awesome. Perfect. So yeah, I think that's a great segue. A lot of what I do is not only helping people handle that pain, whether it's through hands-on techniques that are different than what Dr. Casey does, but hands-on techniques and just good pain control techniques. But we also start to retrain the body how to move a little bit better and take some stress off of some of those areas that are starting to cause some of that potential pain. Okay, so some of the big things I'm going to talk about here today, kind of the number one thing I want us all to keep in mind as we go through this is that not all back pain is always the same, right? There are a lot of structures in that area. So Dr. Casey hit on a big one for sure. I'm going to talk about a couple other things that I've seen that can cause similar symptoms, more specific to the low back. And because not all back pain is the same, it has to be the way we go about treating it, and the types of even movements we do or movements that we need to adjust and make better can be different depending on what's going on. So there's never there's never a blanket treatment, right? There's never, we can't always do the exact same thing, especially in my world, to address everyone's back pain, right? If we're doing the exact same thing to treat every bit of back pain we see, we're going to be missing probably about 2/3 of, about 2/3 of people aren't going to get better with some of that treatment. Okay. So I'm going to share my screen real quick and go into that a little more in depth here. Just want to pull this up here. You can see this photo right here. So this is focused in on the lowest part of the lumbar spine of the low back. So Dr. Casey already talked about how the movement in these joints here can narrow this space around the nerve and cause some pain. That can be from the joint movement. It can be from arthritis buildup in that area as well. It can be because you have a muscle strain in this area. This picture doesn't show the muscle, but there's muscle that sits right in here, in and around this area, and that spasm can change the positioning of those joints and cause some pain. And then we can also have disc herniations. I'm sure many people have at least heard of or maybe even experienced something like that. And if that disc bulges out and crowds the space where this nerve comes out, that can also be a source of that pain. And as Dr. Casey also alluded to, that's when we can get pain that's radiating not only out into the back, but also down into the leg, the dreaded sciatica pain, right? Everybody, that's the hot button topic surrounding back pain is sciatica. When certain nerves in that area are compressed upon, it can cause pain that goes down that leg via that sciatic nerve and cause things like numbness and tingling, weakness in the leg, pain, changes your movement patterns, right? Interferes with your ability to, walk or get up from sitting down or just simply sit, depending on what the cause of that nerve impingement or compression is. So because there are different structures there, they all tend to respond a little differently to the movements in our day in the way that they create the pain. Okay. So some people that have back pain have pain more with sitting and bending over, where other people have more pain with walking or standing for longer periods of time. Right. So that those types of things can give us clues about how to address that. So that's why it's important to talk with an expert, someone who knows movement, someone who knows function, to really treat the root cause of your pain, because it could be potentially making things worse if you're just throwing darts at the dartboard. I see all those articles, and I'm sure Trisha and Dr. Casey, you see the 10 ways to fix your sciatica, and I'm like, oh no. A third of those things could make it worse. A third of those things won't do anything for you, and a third might help depending on what you have going on and what's causing that sciatica. So it's just a big thing to keep in mind when we do talk about back pain, is not all of it's the same, and we have to really treat the root cause in order to address that pain. I have another real fun thing I want to share with you here before we talk about how we can go about finding those things and treating those things, because there's some fun statistics on this that I think are real important. So if you look at this purple picture right here, this is a study called the VOMIT study. Not the kind you're thinking of. It's the Victims of Medical Imaging Technology. And what it looked at is areas of the body that we tend to do a lot of imaging on, and that we tend to correlate a lot of findings on that imaging to the cause of someone's problem. And what it really showed us was that a lot of these things, like disc degeneration, if we look at the lumbar spine and the low back specifically, disc degeneration, and stenosis, which is arthritis, that might be a word you've heard before, are very, very common things. So here it says that disc degeneration is present in 40% of individuals under the age of 30, and in 90% of those between the ages of 50 and 55. So a very high number of those people have it without having any problems, right? I don't think 90% of people between 50 and 55 have like debilitating back pain, right? There's a certain percentage of them that certainly do, but it just goes to show us that just because you have something like this on an MRI or an X-ray means that does not mean that you're going to have pain, or that is it's the only reason that you are having pain. Okay. Now, certainly if some of those structures like the disc or the joints or all those things we've already talked about are pushing on that nerve, they could be a cause of your pain. However, a lot of things that we can do from a physical therapy perspective, and with what Tricia and Dr. Casey do as well, we're not going to get rid of the fact that your discs are smaller now than they used to be. We're not going to get rid of the arthritis in your spine. But what we can do through pain control, through changes in your daily habits, and some of your movement patterns that have turned into compensation over time, and through a good mix of mobility, stability, and strength and endurance, we can take stress off of that area that is putting more stress on that nerve and leading to that pain. Okay. So that's in my experience, in my training, that's usually what this is. It's not necessarily that we've got to go in and get rid of that disc that's pushing on the nerve. Your body will probably take care of that naturally over time. They've actually found that it does with no intervention at all. Within somewhere around 12 weeks on average, your body will absorb a disc herniation, but the pain can still be present because we're still putting more stress on a nerve that's already flared up from one reason or another. Okay. So the things that I focus on whenever we're looking at back pain is addressing the reasons why increased stress is being put on that area of the spine, causing some more of that, either like Dr. Casey mentioned, subluxation or disc herniate, or making the disc herniate onto the nerve, or just making that nerve not happy, right? So we need to cumulatively take the stress off of that area of the spine, give it a little more support so that we're not only dealing with the pain that you have now, but we're preventing it from coming back, right? And we can keep that where it needs to be by working on certain things. Any questions on that stuff so far? And again, by all means, please throw questions in the chat as we go. We will have a Q&A at the end of all of this. But that's really where I look at is, how are you moving? Where is this sort of coming from? We're going to identify more of the root cause of the problem, and then address the pain and that function, and get you moving in less of a compensatory pattern, because our bodies are master compensators to a fault sometimes. And we need to correct those compensations the best that we can. So a couple of things I want to show you all, a couple of quick things that you can do that you might be able to incorporate depending on when and where you might be getting a little bit of back pain. Okay. So I'll preface this by saying, if you pick the one in this video that seems to match with you and it doesn't feel good, number one, give us a call, right? reach out to us and talk about this a little bit. But these are all pretty safe movements, pretty basic things that can not only help with a little bit of back pain that you might have going on, but can help people in certain areas prevent some of it as well. Okay. So I'm just going to share my screen one more time here. And so this here is called a prone press up. So if you have a lot of pain with sitting and bending over, this can help take some stress off of those nerves in that position. So in this lying down position, you're just kind of pressing up onto your elbows and coming back down. Okay. It's that easy, right? Just pressing up and coming back down. Again, that's really good for helping take some stress off of the discs in the low back. Can help decompress those discs a little bit. Now, if you get pain with standing and walking, we don't want to be doing this. Okay. So please don't do this if you get pain with those things. But if you tend to have pain with sitting and bending over, this is potentially something that can help you. If you have a job where you have to sit a lot during the day, or you drive a lot, this one can be good to just work on some preventative maintenance, because you might be in a lot of flexion. You might be bending a lot and rounding through your spine during the day. And this can work you into a position opposite that and can be somewhat preventative as well. So if we move on here, This can be great if you have some muscle spasm going on. So that pain where when you turn or move the wrong way, it kind of grabs you, sort of that lightning bolt type pain across the low back. Oh, getting ahead of myself in the video here. So this position, it's a classic yoga move, right? This is a move that a lot of people might have seen in a yoga practice before, but just slowly arching your back and then returning from that position. Just try to get those muscles moving and loosening them up. The next one we call a prayer stretch, which is great for pain if you have pain with standing and walking. Coming back out, and you can see there that I walked my hands up. I walked myself back up with my hands when I came out of the stretch. That's so that we don't put more stress on some of the musculature in the low back while you're doing that particular exercise. If we stretch a muscle out and then ask it to work, we could actually be setting ourselves up for some back pain rather than relieving it. So we don't want to be setting ourselves up for that. So in each of those instances, we're addressing different structures in the back that could be part of the root cause for your back pain, depending on what's going on. But there are plenty of other areas like strength, stability in the hips, activation through key muscles in your core, as well as mobility through your hips, pelvis area, as well as up into your mid back, that also need to be looked at, assessed, and addressed. But those couple of things, depending on what kind of fits in the category for you, could be something that could give you a little bit more information about what might help you with back pain. And those things can be preventative. So if you're on your feet a lot, that last one and the one in the middle is actually a pretty good one to be doing. If you're sitting a lot, that first one is a pretty good one to be doing and can kind of be used as a preventative measure. But I think the big take home here is if you're having back pain and you've even tried some of these things before, or you even try these and it helps a little, but it doesn't take care of it, definitely reach out to a professional that can help you find that root cause and address all of the potential contributing factors so that we actually treat the full root cause and can work you into some prevention as well, because movement is fantastic for back pain. And I can't think of a better way to segue into Trisha because Trisha is all about movement.
Yes. Hey, thank you, Dr. Phil. That was a great presentation, as well as with Dr. Casey. So for personal training, obviously I want to prevent back pain. But before, when you start with a personal trainer or before you start your exercise program, we work through an assessment first. And what we're assessing is what Dr. Phil had mentioned, is any compensations. We're sitting a lot. Are you doing construction? Are you reaching a lot? And so we're looking at the neuromuscular. So the nerves, how the nerves and the muscles are working together. And many times we're going to have one muscle that's a little overactive. So it's going to be tight. And so your muscles should be here. They should have, a symmetrical length. And sometimes if it's overactive, it's going to shrink and be tight. And then the underactive is going to be long and overstretched. So during your assessment, we're going to look at what we need to, at personal training, focus on so that your neuromuscular efficiency is optimal. That's number one. And then obviously work through our goals. So when we set programs, we follow a 3-phase program. We follow, first and foremost, we do a stability phase. We want to make sure that you are stable, you have balance, and then we go into the strength. So if people's goals are to, build more strength and to actually maybe hypertrophy, which I can't say very well, and gain the toned muscle, or power we all need so that we can react quickly, etc. But for this episode of this WebEx, I'm going to talk about how to prevent low back pain. Low back pain is the most common cause of inactivity or limitation in adults ages 45 and younger, and only second to arthritis, which I thought was pretty amazing, in people ages 45 to 65. And it is the primary cause of muscular degeneration in most adults, affecting 80% of us. That's crazy. And what's even crazier is the amount of money it takes. I mean, the economic impact. So think about the time you've spent away from work, the time that you're going to, prescription drugs. It's costing us over $100 billion a year to help with our low back pain. So that's what I'm here for. I want to help prevent that low back pain. So you can go to the next. And I had already sort of indicated this. It's predominant low back pain because of our function, what we're doing functionally. We have the overactive and underactive muscle. People that sit along, sitting is so bad for us. So we get the hip pain, we get the low back pain, and then anybody in manual labor, construction, farming, etc., really does not do our body well, and our nerves and muscles just can't react the way they should. If you want to go to the next. So first of all, I want to talk about the core. When you are thinking of preventing low back pain, we have to start with the core. And the core, most people think, is the six packs. It's the rectus abdominis. It's what everybody thinks of. But the core actually includes so much more. And we call it the lumbar, I can't really see my slide too well, pelvic hip complex. And it includes the spine, obviously, the pelvic girdle, the abdominals, and the hip joint. So the core is so much more than that six pack. And we want to make sure that we have a stable core. And that's the first step in personal training or your training for physical exercise. So if you think about the core muscles, the local stabilizers, they all attach to the spine. So to those nerves are talking through it, and all the movement from your vertebrae. So those are the muscles we're going to work first in our training sessions. And you can go to the next slide. We have found that if that local core muscles are weak, it's inefficient, it's causing movements that we're compensating for, that's going to cause that low back pain. So we want to make sure that we have a strong core stabilizers so that we keep that strong base of support, our center of support. And next slide. There you go. All right. So when we start with our core training, as I mentioned earlier, we have a three-phase approach. We start with the stabilization. So when we do core stabilization, it simply means that there's not going to be any movement of the spine. We're going to learn how to brace and to brace that spine and really feel the core and the hips, the whole lumbar pelvic hip complex work together to stabilize. And there's certain exercises that we start with. I like to always start with lying back on the floor and just working the pelvis and doing what I call a pelvic tilt. So I can feel my pelvis press into the floor, and I work those muscles so that the client can really see, am I arching my back? Am I too much, which is going to cause stress in the lower back. And then we start with marches. So you can see in this picture here where the woman is pressing her lower back into the floor. And while she's marching her feet up and down, we're bracing those core muscles, and we're assuring that during our movement that those core muscles stay stable. Other exercises that we're going to work on, again, because we're in the core stabilization phase, there's not going to be any movement in the spine. So we also do a prone. We're going to do a plank, a regular plank, either on your hands or on your elbows. We do the cobra, which Dr. Phil showed. There is movement, we're bending, we're flexing, but it's not very large. The range of motion is low. So that's very important to start at the local core stabilizer muscles, and then keeping that spine nice and strong. Moving on, we go into core strength. And you're going to stay in the core stabilizing, probably depending on where you are in your fitness level. And if we saw any muscular inefficiencies during our assessment, you probably stay in that stabilization for about 4 weeks. Then we go into the core strength because we really want to strengthen the muscles. We want to start being able to take that movement into a functional, more of a functional movement for us. So that when we go to pick up that, I don't know, people just picking things up off the floor and then all of a sudden they're like, oh my God, my back. So that when we start picking items up off the floor and we start twisting, we know through our strong core that we're going to keep those muscles working together efficiently. So when we start with the strength section, this is where we're going to start adding more dynamic movement through full range movement of your spine. And this is where you're going to start seeing where we're going to do crunches. I usually start on the ball, as you can see in this picture. It's more of a unstable environment, so that as we're starting on this unstable environment, we know that we're going to contract, we're going to brace that core so that we can move, because we are not in a stable environment all the time. You know, you're walking fast, you might trip over something. So you need to be able to learn how to quickly brace so not to injure yourself. So we're going to do the ball crunch. We're going to do back extensions. Reverse crunch is where you lift your hips up off, instead of doing a crunch where you're pulling your chest forward, you're going to do your hips up over your chest. And then some cable rotations for the outside movement. Then our last stage is core power, because power is increasing the rate of force production, maintaining stability. The exercises are powerful, they're explosive. Usually anything with a medicine ball, throwing, tossing, so soccer throws, medicine ball, pullover throws, a rotational chest pass. It's so that in your everyday life, we're constantly going back and forth. And again, we're going back to that local core stabilization, and we're making sure that it's nice and strong so that when we do move functionally, we are keeping everything in line. Good. And then lastly, just to summarize this, is that, you know, your movement comes from your center of gravity, which is your core stabilizers. It's your spine, it's your pelvic girdle, it's your hips, it's the lumbar pelvic hip complex, if you can remember that one. So don't skip the core exercises in your training program. They're there not just for aesthetics. It's there not just for the six-pack abs. It's really for your health. And for me, health and wellness is not about having the six-pack. It is about being healthy and strong and being able to move functionally without pain. Increasing your core strength will help you rely less on the pain treatments such as medications. And this is Perfect Fit Health and Fitness. We would love to help you start or continue your journey with physical fitness. That's about it. If you have any questions, let me know.
Awesome. Great stuff there, Tricia. That was a very good, well-rounded look at the progression that this takes. And I think that's really important to mention when we talk about the treatment of back pain. And I think that's a good segue into another thought I had, that you could all see through the presentations that there was a fair amount of overlap at certain key points from all three of us, right? So with Dr. Casey talking about making that nervous system work better, right? And get more to function, right? And there's overlap there with what I work on, which is some pain control techniques and working out of some of that compensation from a more movement standpoint while we're still controlling the pain, working through a progression there where there's overlap between myself and Tricia, because some of the things that she talked about in her stabilization sequence of the core specifically are things that we might have already touched on if we were working together, right? And then there's a higher progression where once that pain is more stabilized and we've addressed all the other imbalances from a movement standpoint and whatnot, that's when you can, there's a transition period there to working more on that higher level of stability and into power, right? That Tricia just talked about and wrapped up with. So there's I think another big take home here, and obviously Trisha and Dr. Casey, feel free to chime in here on this too, is that a team approach can be very effective. And if we're doing things the right way in the right progression for you and your current bout of back pain, or even if you've had it before, you don't have it now, but you want to make sure it doesn't come back, right? We can, the team approach here can really evaluate where are you in that journey, where are you at, where do you want to be, and what's the best way for us to get you there, right? And there's going to be different things that all of us can do along that journey, but there's definitely overlap, and making sure we're working through that progression the right way is going to make the treatment and prevention of something like low back pain that much more effective.
Yeah. Can I pop in and say something to you, Dr. Phil?
Of course.
One thing that none of us mentioned, which is this definitely needs to be mentioned, is that low back pain, it might be common in our society because of our lifestyles, our food choices, our work associations, and how we do a lot of sitting. But it needs to be mentioned that low back pain isn't normal function of the body. You should not have low back pain.
Yes.
Low back pain is your body's fire alarm system telling you that something isn't right here. And it's trying to have you slow down, assess, and it's asking you to assess what this underlying concerns are. Because many, many times low back pain comes from a dysfunction that's been there for quite a while.
Mm-hmm.
And if, like we talked about, you might learn some tips and tricks from friends, neighbors, internet, other resources. But if you don't have somebody who's looking at it from a different perspective, you might not see the results that truly you're looking for. So I wanted to point that out too. Even though it's common in our society, low back pain is not normal function.
That's a huge point. And I think that ties in a little bit to what we were talking about with that medical imaging study that I showed there, right? A lot of those things that other medical professionals might say, this is the reason why your back hurts. Again, we're probably already there, right? Mm-hmm. That's you've been dealing with those in your body for a long time without even knowing that they're there. So let's look at the whole picture and figure out why that has now become painful. And even Trisha, one of the statistics you had about arthritis being just above back pain in that age group, that 45 to 65 year old age group. Arthritis is another thing. And in my world, balance and falls, well, Trisha as well. Those are back pain, arthritis, and balance and falls are three things that for some reason, a lot of folks in our medical system have just accepted what the statistics say, that they're going to happen. It's going to be a problem and we're going to have to deal with it, but we don't. And when we start to notice those things, the faster we address them, the better off we're going to be, not only right now, but in the long term. Mm-hmm. And they can all be prevented. Pain from arthritis can be prevented. We can't prevent the arthritis. That's a natural process that the joints in our body go through, but we can prevent it from being painful. We can make sure it doesn't become painful. And if we have pain from it, we can take it away. Same thing with back pain, like what Dr. Casey said, and I'll throw the balance in there as well. Yes, there are certain things that happen that as we age that we can't always change, but there's a lot that goes into balance that we can change from a physical function standpoint. So that's a great point. I'm really glad that you threw that in.
Yeah, of course. It's always great to keep asking questions, ask questions until you find the answer that you're looking for too. Because each person has each practitioner, each provider, each doctor, each person has a different education base, and what you're looking for they might not necessarily have the answer to. But if you ask Dr. Phil, if you ask Trisha, if you ask somebody else, they might have what you are looking for.
Exactly. And in our state, I know for Trisha, for you, correct me if I'm wrong, I don't think chiropractic has ever needed a referral at all. I think that's always been a direct access thing. There's a lot of confusion about that around physical therapy. And in the state of Maine, you can reach out to physical therapy directly. You do not need permission or a script or anything like that to go to and see and talk to and be evaluated by a physical therapist, which is great. You have access, and you definitely don't with Trisha, because that's just a choice and an investment that you make to improve your physical function and your overall health. But you've got a lot of options out there, and three people right here that are more than willing to answer questions and help you navigate that process, and make sure we do it the right way, so that you're good not only now but moving forward as well.
Absolutely.
Awesome. So definitely would love to open it up to questions, a little Q&A. If anyone does have questions, you can unmute yourself and ask the question, or you can throw it in the chat. We'd be more than happy to answer any questions that you do have at this time. Don't be shy. All right. Okay. Well, if there aren't any, if there are after the fact, you can certainly reach out to all of us. You can find all of us on social media, right? Actually, why don't we do that before we wrap up? Dr. Casey, what's the best way for people to find you? How can they reach out to you?
Yeah, of course. Our website is probably the best bet for you. We do have an online scheduler, so you could take a look and see if there's an opportunity that best fits you. But that's going to be www.unboundpotentialchiro.com. And my cell is also listed there as well, so you guys can have direct access to me. And I think that's pretty awesome, as many times you call a facility, leave a voicemail, things of that nature, and you're never quite sure if you're hearing back from the doc or not. So direct access at www.unboundpotentialchiro.com.
Right.
Awesome. And Trisha, what's the best way for people to reach out to you as well?
Sure. So, obviously 3 ways. I've got the Facebook page and the Instagram. Both are at Perfect Fit Health and Fitness. And then my website, you can actually click on message me, and that is www.perfectfithealthandfitness.com. So you will see, you can contact us for an assessment, a free assessment, to take personal training classes. If you need help with nutrition, there's nutrition coaching there. So my email is there, my phone number is there, but if you message me, I'll get back to you as soon as possible.
Awesome. And for myself, my social media channels are at WorkFitME on all platforms. You can also look on my own personal Facebook page. If you just search Phil Finnemore, you should be able to find that. My website is workfitme.com. And just like Dr. Casey, I am full direct access as well. So the phone number listed on there is my personal number. You can call, text, any questions that you have, and the contact section on there goes right to my personal email inbox. So you're going to get a direct response back from me if you have any questions at all. So if there aren't any big pressing questions, we want to thank all of you for joining us today. We really enjoyed chatting about something that all of us are very passionate about, and maybe hopefully debunking some myths out there about back pain, and showing you that this isn't something we have to be okay with, and it's something that we can not only treat and manage effectively, but we can prevent it from either happening again or ever happening in the first place as well. So thank you all very much, and go enjoy the rest of your beautiful Saturday.
Bye, guys.
Thanks, guys. See ya.